Hello, everyone, and welcome to today's Keynote webinar titled The Safety and Relative Effectiveness of Non-Psychoactive Cannabinoid Formulations for the Improvement of Sleep, a double-blinded randomized controlled trial. This webinar is a part of the 6th annual event in the 2023 Cannabis Sciences Virtual Event Series. I'm Antonina Salcido of LabRoots, and I will be your moderator for today's event. Today's educational web seminar is presented by LabRoots. Before we begin, I'd just like to remind everyone that this event is interactive. We encourage you to first participate by communicating with other attendees using our live chat feature during the presentation. You can find the live chat located at the left of your screen. You can also participate by submitting as many questions as you would like during the presentation. To do so, simply type them into the Ask a Question box and click Submit. We'll answer as many questions as we have time for at the end of the presentation. If you have trouble seeing or hearing the presentation, click on the Help Desk button located at the top of your screen within the navigation bar or from the lobby within the event. Finally, as a reminder, this presentation is educational and offers free continuing education credits. Click on the Continuing Education Credits link located in the Abstract tab from the menu at the left of your screen and follow the process to obtain your credits. Now let's get started. I now present today's speaker, Dr. Susan J. Hewlings, RD and Vice President of Research Affairs at Radical Science. For a complete biography on our speaker, please visit the Presenter tab from the menu on the left of your screen. Welcome, Dr. Hewlings. You may now begin your presentation.
Thank you. Thank you so much for the lovely introduction, and thank you to everyone that's present. And I will appreciate your intuitive questions, and we'll definitely address those within this presentation. I present this on behalf of the team at Radical Science and have the authors of the recently published study that we're going to discuss today here on this slide. Just to tell you a little bit about who I am. My background is I have a PhD in nutrition and a master's in exercise physiology and a bachelor's in nutrition, all from Florida State University, and I'm a registered dietitian. I also, in the last few years, obtained a graduate certificate in cannabis science from the University of Vermont Medical School. The majority of my career I've spent in higher education. Currently, I'm an adjunct professor at Nova Southeastern in Fort Lauderdale, previously at Central Michigan University, at University of Central Florida College of Medicine, and I started my career at Stetson University. Currently, as mentioned, I am Vice President of Research Affairs for Radical Science, and I'm also an author, medical writer, and consultant in the dietary supplement, CBD, cannabis, beverage, and food spaces. So I'm going to share some information with you today about a Radical Science study. So let's first talk about sleep. Everybody can relate, and I think it is a topic of common conversation. People talk about it all the time, right? It's almost like a friendly cultural greeting. How'd you sleep? And people are very open about talking about it. But if you just ask yourself this, because I think that there's a certain amount of personal answer to this, like what is good sleep? It's kind of an interesting question because we say it all the time. I slept well, I slept crappy. I just, what is it? So think to yourself before I say the research definition, say to yourself, what is good sleep? And it's kind of interesting and people like to talk about it, right? Oh, I sleep best like under a real heavy blanket. I like a weighted blanket. I like it to be frigid, like I turn my AC way up, blah, blah. But I just gave you one definition. So keep in mind, I probably could have done a whole presentation on definitions of good sleep. This is just from one article, and it's good sleep health is characterized by satisfaction, appropriate timing, adequate duration, high efficiency, and sustained alertness during waking hours. I chose that definition because it really does incorporate all aspects of sleep. And when you read articles or when you look at things that claim to support sleep, it's important to keep in mind that sleep is actually very complex, and it actually incorporates a lot of different things, like how fast you fell asleep, how long you stayed asleep, etc. And so even though we use it in a broad term, it actually has a lot more complex and multidimensional aspects to it than I think we initially associate with it. So I just wanted to put that out there right up front. The other thing is to consider, like, how much sleep do you actually get? Like, if you had to average it out, and then really, like, how much is enough? Because I think we have somewhat of a skewed idea of what is adequate sleep. But this is from a study conducted a few years ago, looking at hours of sleep during during a working week, and it compared it by country, and that's just a few of the countries that they studied. So then they broke it down by less than 6 hours, 6 hours, but less than seven. You can see how they broke it down there. And you can see that in the US, we have quite a few people that are getting less than 7 hours of sleep. So like the first two lines across. And if you combine those two lines, more than 50% of the people surveyed get less than 7 hours of sleep. So 60% of the people report sleeping less than 7 hours. And a lot of people think, well, that's fine. That's okay. And actually, that's not enough sleep. So why is it a big deal? Why does it matter how much we sleep? Why do we talk about it so much? Well, it is such a big deal that it's actually a huge public health concern. This fact that we don't get the right amount of sleep, or the 7 hours or more. And in fact, it's such a big public health concern that Healthy People 2020, which is a public health initiative that's put out federally, that as part of the 2020 initiative, the Center for Disease Control and Prevention partnered with the American Academy of Sleep Medicine to improve sleep health and increase the numbers of Americans getting sufficient sleep. So it's a huge initiative across many organizations, including the CDC, American Academy of Sleep. You'll see the World Health Organization weighing in on such a thing. So an interesting fact is that it's such a concern that it is incorporated into major public health initiatives. Why? Well, why is because not getting adequate sleep has huge impacts on all aspects of health and physiological functioning. In addition, we can look at sleep from all these different ways too. So while we look at the fact that not having healthy sleep or enough sleep impacts all these systems, in turn, we can look at sleep being affected by all of them as well. So in other words, if you have a disturbance, let's say you are suffering from chronic inflammation, or you have a hormonal disruption or imbalance, that will impact sleep. And in turn, having unhealthy sleep or inadequate sleep will impact those things. So there is deep connection here. And so when we look at the dimension of sleep, which were incorporated into our definition of good sleep that we started with, like satisfaction, alertness, efficiency, duration, all of these things that factor in, all of those impact sleep, which in turn impacts epigenetic, molecular, cellular processes and expression of these things, which also impact inflammation, sympathetic nervous system activation, stress, hormonal responses and hormonal balances. Lots of studies looking at shift workers and how they how that is impacting how the shift is impacting all of these things. and looking at, for example, one place where we see a lot of research is looking at how shift work impacts metabolic syndrome and insulin resistance. And so again, we see that sleep disturbance connected to health outcomes, and part of that becomes also lifestyle factors. So everything is integrated and sleep is at the center. It's not just this separate entity that we talk about. It's an integral part of overall health and all systems. So one thing that came out of the pandemic is a renewed focus on the fact that sleep and lack of it can be a sign of other problems like stress and anxiety, when it can also influence them as well. And we saw a lot of individuals turning to alternative medicines and alternative options for addressing their sleep disturbances. Like people finally started admitting, yeah, you know what, I don't sleep that well, and I really need to do something about it. Traditionally, of course, there's a lot of prescription medicines available for inadequate sleep. But of course, they have very negative consequences, very many side effects potentially for people. There are even some of them that are addiction risk. And so people often will seek alternative and complementary options. One of the most common that we see people seeking, of course, is melatonin. People, most people have heard of melatonin. It's integrated into many of the sleep products that we see, but it's not without its side effects. And a lot of people report that they can't take melatonin, despite the fact that it's integrated into so many things. They can't take it. It leaves them groggy, or it leaves them feeling, quote, hungover. And it also has been shown to have side effects whereby it negatively interacts with circadian rhythms. So the idea to look for things that can be alternative to melatonin is very appealing. But the thing about it is that for most people, even if they have side effects, it does work. And there are lots of studies to show that even a small amount of melatonin can help support sleep. So, for example, a positive effect has been seen on how long, or sleep latency, how long someone sleeps, sleep duration, in doses of melatonin as low as 0.3 to 1 milligram. Typically, we see a plateau evolve from there, that you don't see that much of an added benefit beyond 3. But nonetheless, we see a lot of formulations that have a 5 milligram dose of melatonin. So the reason we see it a lot is because, in fact, it has a lot of efficacy data associated with it. So because a lot of people experience side effects, et cetera, or just don't like to take it, or don't want to take the risk of messing up with their natural melatonin and their natural circadian rhythms, there's a lot of interest in seeking substances that would benefit sleep to the same level as melatonin without the side effects. And one of those areas where a lot has been said about its benefits for sleep is CBD. So there's been a lot said, a lot of claims, a lot of products put out there saying that, CBD benefits sleep and that it is actually better or offers superior benefits to melatonin. Despite these claims and lots of these things you see on social media, on Amazon, on labels, there really hasn't been any studies to support these claims and to say, yes, in fact, CBD works, and it works better than melatonin. So there's a lot of research on CBD that show a lot of its benefits. We've all seen those, and we've seen the benefits associated with inflammation, et cetera. But the studies showing CBD in sleep are minimal. And also when you consider how many of those studies that show that it benefits sleep have been done in healthy people that don't have any sort of a disease or diagnosis. Sure, they may have some minor sleep problems, but not a sleep diagnosis. But the minimal studies that are out there about CBD and sleep are mixed. So there have been interest in exploring some of the other cannabinoids. So even though most of the research on the cannabinoids, especially in reference to sleep, has been on CBD and THC, we have to remember there's a whole lot of other substances in the cannabis plant, other cannabinoids, and also, of course, the terpenes. And so the idea is that many of these may be of interest. There's been a lot of interest related to sleep for CBD and, CBC and CBN. And the idea is that they may be able to benefit sleep either by themselves or in combination with CBD. Like perhaps together, they may boost the effects or the benefit of CBD. So it would be very interesting to see like studies that are multi-arm studies that allow for direct comparison so that you could look at the cannabinoids by themselves, the cannabinoids in combination, and see how they compare to melatonin, since so much is said about that they're better than melatonin or that they compare. And the reason for the interest in the cannabinoids is valid, right? So when we go to substantiate a claim in the dietary supplement space, the first place we want to look when we get started is we want to look at mechanism of action. In other words, if we're saying supplement A has this effect on X, does it make sense that, like, from a physiological biochemical mechanism, that this could actually be? That's kind of where we start. And we say, okay, is there a plausible mechanism of action? And so when we look at the idea that the cannabinoids could benefit sleep, we definitely can establish a very, very plausible mechanism of action, because if you consider the endocannabinoid system, right? And so the idea that the endocannabinoid system is, present in every animal, and that it's integrated throughout our physiology and is thought to have evolved from like stress harm regulation and helps the body get back to homeostasis. Well, that's kind of what sleep does, right? It helps us repair, recover, adapt. Even though we don't 100% understand all of the physiological benefits of sleep, we can kind of, we know that that's part of it, repair, and et cetera. So the endocannabinoid system offers an interesting, plausible mechanism of action. It communicates with all other systems in the body, and it's thought to be involved with multiple regulatory functions for health and disease. And we also have evidence to show that it is impacted by lifestyle behaviors like exercise and sleep and medications, and the cannabinoids, and the idea that we have endogenous cannabinoids, or cannabinoids inside our body, and the exogenous ones like CBC, CBN, CBD. So it makes sense. So the idea is that the cannabinoids, or that the different cannabinoids, whether they be phytocannabinoids, synthetic, endogenous, would impact or influence our endocannabinoid receptors. So the reason that we know that we have these, and the endocannabinoid system is throughout the body, is we've identified CB1 and CB2 receptors. And so the idea that these different cannabinoids impact the endocannabinoid system via these receptors help us to further describe or define our mechanism of action. And we know that the endocannabinoid system can regulate a lot of processes. So that, for example, it plays a role in pain, inflammation, immunity, memory. So discovering things that impact that could make huge changes in health. So sleep is one of those things that's like on both sides of it, right? It influences it on one side and it's affected by it from the other. So it really is an interesting way to explore this, and our mechanism of action starts to really take place. And this is another slide from a study that shows some of the relationship that ties everything together. So, and I gave you the references if you want to go see the full context around these images I've provided. So we have the cannabinoids like the phytocannabinoids or synthetic or exogenous cannabinoids, CBD, CBN, THC. Then we have underneath of that, you can see our endogenous cannabinoids, the two most studied being AEA and 2AG. And it's showing how, from a plausible mechanism of action, they influence the CB1 and CB2 receptors. And then on the right, we have the different effects or relevant observations, so that if we look at studies where they do like sleep deprivation, they'll show that we get an increase in the endogenous cannabinoid 2AG. And so it's, again, showing all the different ways how if you administer AEA, it will increase sleep. And so, again, further supporting in preclinical data, most of those studies have been done in rodent models. It is further supporting from preclinical data this connection that we have. But we still get to the fact that we just have few clinical trials in humans, especially healthy humans, that help us to establish what these effects may be. So this, in turn, is what our study sought to report. Because the research that does exist out there is very small. It's done in very heterogeneous populations. Many of them didn't even report on whether or not the sleep benefit was clinically meaningful. So in trials, we look at statistical difference, statistically significant, but we also need to look at clinically meaningful. I mean, is this really going to express itself in something that benefits the participants or the patients meaningfully? Lots of bias in the studies. And the other thing that becomes hard when you look at the studies that do exist, the minimal studies that do exist, is the formulas and the consistency, potency, purity, et cetera, of the formulas. And so these things have kind of limited a lot of conclusions that can be made. And so in our study, we sought to address the gaps in the literature by investigating the effects of daily use over 4 weeks of low-dose CBD and melatonin formulations. We looked at them alone and in combination with certain minor cannabinoids, assessing them on sleep quality. So the primary objective was to compare the safety and the efficacy of CBD isolate to combination formulations. So these formulations had CBD and minor cannabinoids, and they were with and without melatonin. And we were looking to see if the addition of melatonin and the minor cannabinoids would offer a benefit. So where do we get the best benefit for sleep? CBD by itself, CBD in combination with melatonin, or the other cannabinoids, or melatonin by itself, et cetera. So we were looking to see on a secondary endpoint is if the addition of CBD and CBN would confer any therapeutic benefit to the formulation with melatonin. So basically, we wanted to see, are these claims made about comparing to melatonin supported in the studies? So not just are they supported when we have people take the supplement or take the CBD formulation and come into a sleep lab, but we wanted to see, what do the people who are most likely to buy this on the marketplace, right? So the demographic US consumer who would be likely to purchase such a product, what do they report experiencing? So the templated research design that we utilize at Radical Science was applied to study this. We used a randomized, double-blinded, parallel design. The study was virtual, so completely decentralized. We recruited the subjects via social media and other online venues, and the entire study was done decentralized. So what that means is that the subjects were recruited online, and if they met the inclusion criteria, and the inclusion criteria were minimal, we looked for adults that were healthy, that had minor sleep complaints, weren't seeking people with diagnoses or anything like that. So minor sleep complaints, otherwise healthy adults, anywhere in the United States. So we didn't study this in another country or anything like that. We recruited them. If they passed the inclusion criteria, they were randomly assigned to one of our 6 arms. Here you can see what the 6 arms were. The arm 1 was 15 milligrams of CBD with 15 milligrams of CBN and 5 milligrams of melatonin. Arm 2, 15 milligrams of CBD and 15 milligrams of CBN. Arm 3, just 15 milligrams of CBD. Arm 4 was our melatonin only with 5 milligrams of melatonin. Arm 5 had 15 milligrams of CBD full spectrum and 15 milligrams of CBN. And Arm 6 had 15 milligrams of CBD, 15 milligrams of CBN, and 5 milligrams of CBC. So there was no placebo. This wasn't a placebo trial. This was a comparison of the 6 different formulations. The participants were instructed to take 1 capsule each day with food before they went to sleep. They were told that they could increase to 2 capsules, but otherwise the instructions would stay the same throughout the 4 weeks. They were not to exceed 2 capsules. Our measures that were taken at baseline and follow-up and every week throughout the 4 weeks are listed here. What we use for our study measures in our decentralized trials are what are called PROMIS assessments. PROMIS evolved and was developed by the NIH Toolbox, an initiative put forth by the NIH originally to report patient-reported outcomes for clinicians so that clinicians could actually see if their treatments were benefiting their clients or patients from how they felt on a daily basis. So not just like, did their brain waves change, while they were sleeping, but did they feel better, sleep better? The PROMIS initiatives have been developed for many different conditions and feelings. For this study, we used the sleep disturbance, the anxiety, the survey called PEG, or Pain Enjoyment General Activity, and then we used a survey from the World Health Organization called the Well-Being Index. All of these studies have been validity tested in healthy people. They've been highly utilized and tested, and they're well recognized by experts for their indications. And the description and scoring interpretation are written here. Furthermore, these assessments are readily available. You can Google them and find them. So we analyzed the data after the study using a linear mixed regression model. And what we found was that all of our 6 arms experienced a significant improvement from baseline. So a significant improvement in sleep. And that's what you see in the graph there. You can see that, yeah, they slept better. Our arm 2, which was our 15 milligram CBD combined with 15 milligram CBN, that was the arm that performed significantly worse than melatonin. Because remember, what we're trying to do is see is like, okay, is this melatonin, how does everything compare to melatonin? 4 of the 5 products showed sleep improvement comparable to the melatonin control arm. Only the 1 that we mentioned above performed worse. When we looked in a post-hoc analysis, we saw that arm 1, which was the CBD, CBN melatonin, performed significantly better than the arm 2. And so what that meant was the addition of melatonin to a product that already had CBD and CBN might offer a little bit more of an improvement. So that, at least at that dosage, at the 15 and 15, addition of a little bit of melatonin seemed to benefit. The arm 6 was marginally, just a little bit, significantly better than arm 2, suggesting that by adding 5 milligrams of CBC to a product that had the 15-15, that may lead to a greater improvement. So basically what we're saying is that either adding a melatonin or the CBC may benefit that 15-15 formula is what we found. Lost my. As I mentioned earlier, is the idea that when we look at health effects of dietary supplements, cannabinoids, etc., it's very important to look not just at the statistical significance, but also if what we're studying produced clinically meaningful results. And this idea of looking at clinically meaningful results has received renewed attention as it has been recommended in the revised FTC guidelines that were put forth late in December. And that this, in fact, start being part of what we're looking at when we're assessing the substantiation or efficacy of dietary supplements. What we saw was that most of our participants in every arm experienced a minimal clinically important improvement in their sleep disturbance. So what we show in the table here is the proportion who experienced a minimal clinically important difference in their sleep disturbance scale by study arm. So it was pretty equal across. We don't see a big difference between them. Slightly less in that arm too, just like we saw with significance. But they all experienced a clinically meaningful difference in sleep. This is just talking about absolute changes in sleep. And so this is interesting that participants slept 30 to 90 minutes more by the end of the study. Those of us that are constantly pushing this snooze on our alarm can totally understand how 30 minutes can make a huge difference. And so, again, very impactful and supported by the clinically meaningful data that 30 to 90 minutes more probably makes a difference. Remember that we also had other assessments that we used. For example, our well-being survey, and we saw that all products arms saw a significant improvement in well-being, and that 15 to 19% of our participants experienced a clinically meaningful improvement in their well-being, meaning they experienced a palpable improvement in their quality of life via assessing well-being. So that's huge too. That either by the supplement they were taking or the fact that they were getting that 30 to 90 minutes sleep, their well-being improved in just a month. All product arms saw a significant improvement in anxiety. The 43 to 57% of the participants with anxiety in every arm experienced a minimal clinically important improvement in anxiety. So this is huge as well. Not a big difference between the groups, but we do see that all our groups experienced improvement, that they felt less feelings of anxiety. Now, this isn't like a diagnosed anxiety disorder. This is self-reported feelings of anxiety. Also, pain, which when we make claims, we know we can't say pain. We more consider it discomfort, but all product arms saw a significant improvement in the pain scale. So 26 to 42% of our participants that had at least a minimal level of pain going in experienced a clinically meaningful improvement in their pain. So they experienced a palpable improvement in their quality of life as related to pain. What's also very impactful about this study is that we assess safety. And other than some very minor participant complaints related to fatigue, you can see there the large long bar, and maybe a little bit of sleep disturbance for some of the groups. Nothing that was a safety concern that required that we report what the participant was experiencing to the IRB. So we have another study here to add into the safety profile for cannabinoids, which again is part of the call from the FDA saying they don't have enough safety data in order to make regulatory decisions. Here's more that suggests of all those participants we had there. And we had, it should be noted, because I think I skipped over on the number of participants we had, that we recruited, we recruit for all our studies, I should say. For our templated design, we recruit to have 300 participants. And that is based on our power calculations to appropriately power our survey and assessments that we use. So impactful that the 300 people in each arm, we still experience safety. So in conclusion, our formulations containing 5 milligrams melatonin did perform better than the 15-15 that we talked about, but there were no other observable differences when comparing all the other formulations to the 5 milligram melatonin. There was no evidence that the 15 CBD, 15 CBN added to a formulation with 5 milligram melatonin gave any benefit. So we had pretty equal effects on sleep, but we do have to emphasize we did see a benefit in all of them. There was no evidence that the addition of 15 milligrams of CBN alone or in combination with 5 milligrams CBC will improve the effectiveness of CBD. So when we combined them, we didn't really see. And there were no significant differences in side effects, as we mentioned. So very important findings. So what's the bottom line? Chronic use of 15 milligrams of CBD was safe and could lead to significant and clinically important sleep improvements, but probably not going to be superior to 5 milligrams, not in this study, not going to be superior to 5 milligrams of melatonin. So the addition of minor cannabinoids may impart little benefit when added to CBD and melatonin. So they probably don't add a huge benefit to either one, but they did perform the same as the melatonin. So with that, I'd like to say thank you very much, and open the floor to any questions that anybody has.
Thank you so much, Dr. Hewlings, for your informative presentation. We will now start the Q&A portion of the webinar. If you have a question you'd like to ask, please do so now. Just click on that Ask a Question box located on the far left of your screen. Now let's get started. Our first question here is, what role do other lifestyle behaviors play in sleep habits?
Well, that's a great question because, I mean, obviously we didn't have time to go into everything here, but I think it's very important to understand the integration here. And I mentioned it briefly when I was talking about the endocannabinoid system and the fact that diet, exercise, alcohol consumption, and weight, BMI, all of these stress, anxiety, all of these things impact sleep, and in turn sleep impacts those. So to the question, they play a huge role. So in other words, if you really want to improve your health, you can't do it in a silo. It's not just one aspect. It's not just, okay, well, I want to be healthier, so I'm going to focus on my sleep only, because everything works together here. And that endocannabinoid system really adds support to that statement. So they play a very important role. Great question.
That makes sense. Thank you. Another question here, if I understand correctly, why was Oroxin, besides other hypnotics, not used as a comparator?
Well, it was not our intention to utilize prescription drugs. So if that's the question, hypnotics, in my understanding, would be classified as prescription drugs, and that would take this trial into a whole different classification. The goal of this trial and to the assessments that we use are for people who don't have diagnosed sleep disorders. Also, when you do trials with prescription drugs, you open up a whole new level of IRB application, et cetera. So it wasn't in the realm of our study. It would be interesting to do for sure. But again, it didn't fit our subject population we were after either.
Great, thank you for that.
And if I didn't answer that, please, whoever asked it, please let us know.
Definitely. Another question here is, how long did the IRB approval process take, and any lessons to share on that?
Well, in all transparency, I did not do the IRB application. One of my colleagues takes care of all of that. And one of the advantages to the templated trials that we do is that we get a sort of a pre-IRB approval for our study design. And then we do a more rapid approval phase for each individual study. So while it might take a while for an initial study protocol to get through, as we keep repeating them, it's a little faster. Any 2 to 4 weeks is usually what we experience.
Thank you. Some great questions here. Another one is, what makes this trial different than a traditional clinical study?
Well, that's a very good question. Well, several things actually, and I just mentioned our templated design and the fact that we don't customize the studies. And what that allows us to do is in a decentralized model whereby we're using subjective assessments and assessments by consumer. It allows us to recruit quickly. And it allows us to recruit participants from diverse demographics across the US. So, but whereby typically speaking, you would only be able to recruit subjects that would be able to be near the sleep center, right? Or near the CRO or the research facility at the university. They'd have to be at least driving distance to get there. This way we can utilize subjects, we can reach out to participants everywhere. And we can get a real true, if you will, demographic of what the US population really looks like. And the idea, again, back to the FTC guidance, is they want us to do studies on the population that are most likely to utilize the substance that we're testing. And we're able to do that with the way that we can do our recruitment. And the fact that, you know, even people who work and have jobs can participate in our studies. In fact, in this study, more than 65% of the people who participated were employed. Because traditionally, you wouldn't have time to go to the CRO if you had a full-time job. So now we get to assess all those people. In addition, we are looking at how the participants felt. Not just like a biomarker, which is important. That's absolutely important. But in a traditional study design, we may be just looking at a biomarker, or we may be looking, like do a sleep study where we look at brain waves and REM sleep, and we go through but we never ask the person, hey, did you sleep better? And can you rate it and define it and assess it? So to me, this study makes it different in that we're getting sort of that missing piece. Did the person who took the substance feel better after the 4-week period? So that's a huge part of what makes it different. So.
Thank you for all that information. A few more detailed sleep questions. Just in general, why is sleep becoming such a big factor, big question in the cannabinoids discussion?
Yeah, and again, I think that's a great question. I think there are multiple reasons. I think because of the pandemic and you know, awareness of stress and anxiety and mental health challenges, sleep has come into that discussion. And the idea that getting sleep, healthy sleep, is helpful for those conditions, and those conditions impact sleep. And I think also the conversation is that, hey, those things can be issues for people, even if they don't have a diagnosable disorder, and that they can impact your health and your quality of life. Also, of course, the public health initiatives that we mentioned, and the focus of those public health initiatives on sleep. Again, it encourages funding for sleep studies. It puts forth a recognized need, and saying, hey, we need to study this, it's important. So that's part of it. And I think also the really rapidly evolving research surrounding the endocannabinoid system and the impact that it has on many physiological mechanisms has also sparked some of this, because as I mentioned, having a plausible mechanism of action is a huge part of that. And then, as science is supposed to, it generates more questions as we move forward. Each study should give you more questions than answers. Of course, now my professor thing's coming through, but that's just science. It's supposed to give us more questions than answers. And I think that's what's happened. We've looked at the cannabinoids and the endocannabinoid system, and it's giving us some amazing information. And perhaps at the top of that amazing information are the amazing questions that it's driving.
Thank you for that. And I believe you touched on this in your presentation, but why are cannabinoids of interest if there are other options to assist with sleep? What makes them popular?
Well, I think that the minimized side effects are a huge part of that. That's what are driving people for that. Because I mean, people know, I think, at least having talked about several different angles about sleep, like different webinars from different perspectives and different angles, different supplements from sleep. Most people know that melatonin works. They know that there's other dietary supplements too that work, but they don't work for everybody, and people do experience different side effects. So that's part of it. People are driving for different solutions. Certainly people are looking for different solutions than prescription medication for multiple reasons. But I also think because of the focus, from the 2018 Farm Bill and just the absolute, huge discussion surrounding cannabinoids, the fact that it's become legal, it's become socially acceptable, and so really available too because of the Farm Bill. And then, of course, the research is really starting to trickle in from that initiative. So those are sort of all the reasons. But again, it goes back to what I said, just the understanding of the endocannabinoid system and the fact that, hey, we've got something here. Like, we need to figure out what we've got, and we need to figure out what the ideal formulation is, but we know we've got something. And so the science is a big part of it. Yeah.
Well, thank you so much, Dr. Hewlings. Do you have any final comments for our audience?
I want to say thank you to everybody. Thanks for having me. My email is here on my final slide. If anybody has any questions, you can also find me on LinkedIn, and I'm happy to connect with you there. And any questions or discussions that you'd like to have, feel free to email or connect with me on LinkedIn. And thank you so much for having me today.
Thank you again, Dr. Hewlings, for your time today and your important research. Before we go, I'd just like to thank the audience for joining us today and for all their interesting questions. Any questions we didn't have time for today and those submitted during the on-demand period will be addressed by the speaker via the contact information you provided at the time of registration. This webcast can be viewed on demand for 2 years until April 20th, 2025, and LabRoots will alert you via email when it's available for replay. We also encourage you to share that email with any one of your colleagues who may have missed today's live event. Until next time, goodbye.